Results-driven evaluation, implementing your evaluation plan. Evaluation isn't just a compliance requirement, it's a tool to understand, improve, and communicate the impact of your program. Whether you're new to evaluation or refining an existing approach, we'll provide concrete strategies to help you move from plan to action. Slide 2, Session Overview. Today we will cover evaluation components and logic model, goals and objectives, planning evaluation methods, data collection work plan, tracking progress, and analysis, interpretation, and sharing results. A solid evaluation plan is essential for making your data useful. It outlines what data you'll collect, when, how, and why. This clarity supports consistent implementation and helps align team members and stakeholders. A strong plan also lays the groundwork for interpreting and using results later. Slide 3. What is evaluation? Before launching into methods, take time to clarify what you're evaluating. Are you exploring how your program is being implemented or whether it's achieving outcomes? Defining this early ensures your questions are well targeted. A logic model is especially useful here because it shows how your activities are expected to lead to change. Slide 4, Evaluation Plan Components. This slide indicates essential building blocks of an effective evaluation. Let's start at the top left. Number 1, set your goals. This is where evaluation begins. What are you trying to achieve? What are the desired outcomes of your program? Be specific and make sure your goals align with your program mission. Number 2, formulate evaluation questions. Ask, what do you want to learn? These questions should help you understand both your program's implementation and its effectiveness. Good evaluation questions are clear, focused, and answerable with data. Number 3, select indicators. Once you know your questions, identify how you'll measure progress. Indicators are the specific data points you'll track to show change over time, like the number of participants served, participation of behavior change, or improvement in skills. Number 4, gather data. Now it's time to collect the information you need. This could include surveys, interviews, administrative data, or observational tools. Your data collection methods should match your questions and be contextually appropriate. Number 5, analyze and interpret. After data collection, dig into the results. What do they tell you? Are you meeting your goals? Look for patterns, compare against benchmarks, and involve others in making sense of what the data mean. Number 6, use and share findings. Finally, don't let the data sit on a shelf. Share your results with funders, staff, community members, and other stakeholders. Use what you learn to improve your program, tell your story, and inform future decisions. Together, these steps make up the core of any solid foundation. Whether you're working with a small local initiative or a large statewide program, think of this process as a continuous cycle of learning and improvement. Slide 5, logic model. Displayed on the slide is a logic model. A logic model is a foundational tool in program evaluation. It helps us clearly map how our program is supposed to work, from planning to results. These are diagrams or tables that show the relationship between resources, activities, and results. We start with context, the social and environmental factors that shape our program's design. No program operates in a vacuum, and understanding the setting is essential. Next, we consider our assumptions. These are our beliefs about how and why our program will lead to change. These assumptions should be revisited as the program evolves. Then comes your planned work, starting with the resources and inputs, things like funding, staff, and materials, what you need to operate. You use these inputs to carry out activities, such as training sessions, outreach, or counseling. When activities are implemented, they produce outputs, the direct products or services delivered, like the number of people trained or workshops held. From there, we look at outcomes, and these are the benefits or changes that occur for participants, such as increased knowledge or change behaviors. These are the early signs that your program is having its intended effect. Finally, we get to impact, the broader, long term changes in communities or systems, like improved health outcomes or policy changes. These take time, but they represent the ultimate goals of your work. Together, this flow provides a roadmap for both implementation and evaluation. It helps you define what success looks like and how to measure it at every step. Slide 6, from goals to measurable outcomes. From goals to measurable outcomes, revisit your program's logic model or theory of change. Define SMART outcomes. SMART stands for specific, measurable, achievable, relevant, and time bound. Align evaluation goals to program goals. Your evaluation questions serve as the backbone of your design. Ask things like, how well did this program get implemented? What changes occurred for participants? These questions should tie back to your program's goals and be specific enough to answer the data. Avoid overly broad questions that are hard to operationalize. Slide 7, evaluation objectives. To build a meaningful evaluation, we start with two core questions. These questions guide both how we design our evaluation and how we interpret what the data are telling us. First, we ask, has the program been successful in attaining the anticipated implementation objectives? This question focuses on whether the program is being delivered as intended, such as, are you actually implementing the services or trainings you initially planned? Are you reaching the audience you intended to serve, your target population? Are you reaching the expected number of participants? And are you building the partnerships or collaborative relationships you said you would? These are the foundational questions that help us assess fidelity and reach, both which are critical for determining whether your program has the conditions in place to create impact. Second, we ask, has the program been successful in attaining the anticipated participant outcome objectives? This shifts the focus to results. What changed for participants as a result of the program? Are participants showing the changes we hope to see? This could be changes in knowledge, behavior, attitudes, awareness. And importantly, can we reasonably say that these changes happen because of the program and not something else? Together, these two questions about implementation and outcomes help us tell the full story. Did we do what we said we would do? And did it make the difference we hoped it would make? Slide 8, State objectives as measurable terms. Be specific about changes in knowledge, attitudes, awareness, or behavior you expect to occur as a result of participation in your program. Let's start with implementation objectives. These focus on the process, what your program plans to do, who will do it, and who it will serve. First, ask, how will you know the planned activities occurred? You want to track the number, duration, and frequency of your services or activities. This helps ensure that the program is being delivered as designed. Then ask, who will deliver the services or implement the activities? Think about the roles, qualifications, and recruitment plans for your staff. Clearly defining this helps with hiring, training, and maintaining quality. And finally, what population do you plan to reach and how many individuals? Be specific about your target participants, who they are, how many you aim to serve within a certain time frame, and how you'll reach them. This gives you your evaluation a clear scope. Next, let's move to participant outcome objectives. These focus on the results of your program. You'll want to answer, what change is expected to occur? This might be a shift in knowledge, attitudes, skills, or behaviors. Then consider how much change is expected. Setting measurable expectations allows you to gauge progress. Are you aiming for a 20% improvement in knowledge? A reduction in harmful behavior? For whom will the change occur? Be clear about your intended beneficiaries. Are you trying to impact youth, caregivers, professionals? And lastly, how will you know the change occurred? This ties directly into your indicators and data collection methods. Will you use surveys, interviews, observations? Together, these two sets of objectives help ensure that your evaluation is focused, measurable, and aligned with the goals of your program. Slide 9, examples of objectives stated in measurable terms. Many grantees provided objectives or goals using measurable terms. One example of an implementation objective is expand access to workforce development, training, financial skills, and supportive services for youth and adults with disabilities ages 18 and older in the greater Houston area. Another example that a grantee provided is to design and implement an innovative transition and career reintegration intervention with 280 Mississippians with disabilities and long COVID who are seeking to acquire CIE, resulting in at least 150 CIE or post-secondary educational placements. Displayed on the bottom of slide 9 is a table to show a participant objective that's also stated in measurable terms. It uses a table format. In column 1, it states, participants in the PRIME program will demonstrate increases in social, cognitive, career theory outcomes. In column 2, it states the measure, intake survey, and follow-up survey. In column 3, it states the time frame, ongoing. And in column 4, it indicates years 1 through 3. Slide 10, selecting evaluation methods. Next, you'll want to choose methods that help you answer your evaluation questions. Choosing methods depends on what questions you want to answer and what's realistic. If you're asking how or why questions, interviews and focus groups can provide rich insights. Qualitative methods give you stories and context. If you're looking at scale or change over time, surveys or administrative data can be more appropriate. Quantitative methods give you numbers, like you see in surveys or tracking forms. Often, combining methods gives a fuller picture. Slide 11, creating a practical evaluation work plan. Example, here's where we move from planning to doing. Build a work plan that outlines what data you'll collect, when, how, and who is responsible. This keeps your team on the same page and ensures nothing falls through the cracks. A simple table like this one displayed on slide 11 works well. As an example, for column 1, it states the tasks. Conduct a baseline survey. Column 2 states the methods. Online survey. Column 3 states the timeline. Month 1. Column 4 states a responsible party. Evaluation lead. Slide 12, operationalizing data collection. It's important to set up your data systems early. Choose your tools, whether it's Google Forms, Excel, or something more advanced, and make sure your data collection tools are clear and tested. Be consistent and document your process so that others can step in if needed. Slide 13, plan data collection. The table is a simple yet powerful tool to help you translate your evaluation questions into structured, actionable data collection plans. Let's walk through each column to understand how it supports your evaluation design. First column, we begin with your research question. This is the foundation. What do you want to learn from your evaluation? For example, a question might be, did participants increase their knowledge after the training? Or is the program being implemented as intended? Second column, identify your data sources and measures. What type of data will help you answer your question? This could include surveys, interviews, attendance logs, or test scores. And be specific about measures. Are you tracking pre-post knowledge, behavior change, or satisfaction? The third column, specify the party responsible for data collection. Who will actually gather the data? It could be internal staff, external evaluators, or even automated systems. Clarifying this upfront ensures accountability and prevents confusion later. In the fourth column, determine the frequency of data collection. Will it be ongoing, monthly, quarterly, or just at the start and end of your program? The frequency should align with your program activities and allow enough time to observe meaningful change. In the fifth column, you define your sample. Who will you collect data from? Participants, staff, community members? Be clear about the group and make sure it reflects who your program is intended to serve. And finally, in the last column, estimate your expected sample size. This helps you plan logistics and understand the scale of your data. It also helps determine whether your sample is large enough to produce reliable insights. Once this table is complete, you'll have a comprehensive roadmap for what data you need, how you'll get it, and who's responsible. It keeps your evaluation organized, systematic, and aligned with your goals. Slide 14, tracking progress and indicators. Indicators help you measure change over time. For every outcome, define 1 or 2 indicators that help you track progress. Make sure they're realistic and easy to collect. For example, percentage increase in attendance. Create a simple dashboard or spreadsheet so you can monitor changes regularly and adjust if needed. Slide 15, making data meaningful. Once you have data, the real value comes from analyzing and reflecting on it. Before analyzing data, make sure to check it for errors or gaps. Clean quantitative data by reviewing for missing or out of range values. For qualitative data, review transcripts and organize responses into themes. These steps lay the foundation for accurate interpretation. After analysis comes interpretation. This is where you ask, what patterns do you see? What's surprising? What can you improve? What do these findings mean? Are outcomes aligning with expectations? What do the numbers and stories tell us? Consider context, like policy changes or external events. Remember, your analysis should always link back to your evaluation questions. And bring your team together to look at the findings and decide how to apply them to strengthen your work. When possible, involve community members or staff in interpreting results. They bring valuable perspective. Slide 16, sharing results. Sharing your results is just as important as collecting them. Plan your communications in advance so you're ready when results come in, and so that results don't just sit on a shelf. Think about who needs the findings and what format they'll best understand. Share them with funders, staff, community members, and partners. Use visuals like charts and infographics, and plain language. Some may prefer a visual summary, others a detailed report. Celebrate wins, such as sharing success stories, but also be honest about challenges. Evaluation is most powerful when it leads to shared learning and growth. Slide 17, building a learning climate. A learning climate means you use evaluation not just to report outcomes, but to improve over time. Encourage regular check-ins on data. Ask for feedback from staff and participants, and make changes based on what you learn. This builds trust and accountability. Slide 18, final takeaways. To wrap up, evaluation is a valuable tool for learning and improving. It doesn't have to be complicated. By having a clear plan, collecting useful data, and using it to make decisions, you'll strengthen your program and your results. The steps you take from planning to sharing help demonstrate impact, inform future work, and strengthen accountability. Keep your evaluation process intentional and adaptable. Slide 19, contact us. I want to thank you for attending this session. If you have any questions, please reach out to your assigned Evidence Building Support Liaison or the Evidence Building Support mailbox at ebs@westat.com. Also, please revisit the Evaluation Welcome Kit for additional resources and tools to support your evaluation.
Disclaimer. The contents of this presentation were developed under contract 91990023 D0037-91990024 F0395 from the U.S. Department of Education Department. The department does not mandate or prescribe practices, models, or other activities described or discussed in this presentation. The contents of this presentation may contain examples of, adaptations of, and links to resources created, and maintained by another public or private organization. The department does not control or guarantee the accuracy, relevance, timeliness, or completeness of this outside information. The contents of this presentation does not necessarily represent the policy of the department. This presentation is not intended to represent the views or policy of, or be an endorsement of any views expressed or materials provided by any federal agency. Edgar 75.620.